On behalf of the Board of Commissioners, I'd like to welcome the members of the Board of Health, Social Services Board. We'd like to thank everyone for joining us this morning. And at this time, I'd like to introduce our County Manager, Ms. Cannon. Thank you.
Thank you, Mr. Chairman and Commissioners. Today we're gathered to hear a presentation about the options under North Carolina law regarding human services, organization, and governance. This is in response to the discussion that the Board of Commissioners engaged in at your January goal-setting session. At that session, the Board of Commissioners adopted a goal, and that goal was to seek efficiencies and further a review of the human services governance models available. Really, this is the first step in the process, to learn in detail about the options that are available under the North Carolina General Statutes. I would ask you also to keep in mind what your goals are, because I think it's extremely important as you review the options to consider what your goals are, what you want the outcome to be if you decide to make a change. So we thought it was prudent to bring in some experts from the School of Government. So today I'm pleased to introduce Jill Moore. She's an associate professor of public law and government. She's been with the School of Government since 1997, and she is truly an expert on this issue. Her and Amy Wall have been engaged in this legislation as it was being written, after it was passed, but also working with many, many local governments across the state as they decided and opted to make a change under one of these options. Today, she's going to share some detailed information, but also some lessons learned from other government units along the way. In speaking with Jill, she has said that she would prefer that the Board of Commissioners, if you have questions, please ask them along the way. So without further ado, Jill, please come forward. And thank you again for agreeing to be with us today.
Thank you all for having me. It was a beautiful day to drive here from Chapelville. I'm wired up for a couple of different microphones, so I'm just going to, and I've been asked to face this direction for the video, so I'm just going to test this out for a minute and see how we're working. Can you hear me okay?
Yes.
All right. I'll just try standing right here then. My name is Jill Moore, as you've been told, and I am from the School of Government, which is part of the University of North Carolina in Chapel Hill. I want to say at the outset that at the School of Government, we are nonpartisan and we are non-advocacy about policy decisions. We try to support local government officials and others in making their decisions about their policy choices, but we don't advocate for one choice or another. We see our job as helping you understand what your options are and supporting your decision-making processes, but not suggesting that you take one action versus another. So in the course of explaining this topic today and talking about the law itself and the lessons that we've learned watching this law as it was crafted and as it's unfolded over the last 5 years, I'll do my best to explain to you what I've seen, to provide information about my observations, but I won't be making any recommendations or suggestions for what works better or what doesn't work better. We don't actually know what works best for counties. My hunch is that different things work better for different counties because that's usually the case. But we don't have solid research-based information on what's the best answer, so, and I'm not going to pretend that we are. That we do have that. There is a very long history to this issue in North Carolina. There's been a lot of discussion for a long time in North Carolina counties about how best to structure and govern their human services agencies. And I think the context for that for most of our counties is that public health and social services agencies make up a large part of the county budget. And you have a lot of employees in that area as well, but the workforce and the dollars that the county invests into those programs is devoted to a great degree, carrying out programs that are required and overseen by the federal government or by state government. So there's a lot going on in those agencies that is being done by local government employees, but is actually being directed from somewhere else. Before 2012, there were a lot of different strategies that were tried, particularly in my field of public health. I focus primarily on that rather than social services. To try different ways to organize and govern agencies to maximize efficiency, make things best for people who used the different services and so forth. There are multi-county districts in public health. Haven't had those in social services, though they may be coming in the future. A model called Public Health Authority that created a lot of buzz. And then we also had a couple of counties that wanted to try out experiments with something that they called consolidating their human services. And that's mostly what I'm going to be talking about today. Going all the way back to the 70s and then again in the 90s, Wake County and Mecklenburg County got special laws written that allowed them to try out two distinct ideas. One of the ideas that Mecklenburg got into first back in the 1970s was having the Board of County Commissioners assume the powers and duties of human services boards and not have appointed boards anymore. And so that's an idea that goes back to the 70s. But when the law that allowed them to do that was originally written, it was written in a way that said you can't do this unless you have a population of a certain amount, and that pretty much left out everybody but Mecklenburg County, so it was basically a law just for them. In the 1990s, Wake County said, we don't want to do that, but we want to try something different. We want to try putting all our human services together into a single agency, one umbrella agency over all of them, with one umbrella board over all of them. And so they got the Mecklenburg statute amended to allow them to do that. And they had crossed the population threshold that was in the statute by that time, so they were allowed to do that. Other counties were watching Wake and Mecklenburg County and acquiring an interest in what they were doing, as you might imagine. But the thing that kept other counties from acting was that population threshold that was in the law that said you have to have a certain number of people in your county or you can't try these different things out. So in 2012, we got some new legislation. It made a few changes to the original Wake and Mecklenburg legislation, but the main effect of that legislation was that it took the population threshold out and opened up the different options under that law to all of the counties in North Carolina and no longer just the most populated. So most of this presentation is focused on laying out what those options are. Now I'm going to see if I can use my technology. There we go. All right, so exercising any of the new options that were provided by the 2012 legislation would mean a change for your county. And so I do like to start by saying, let's think about what it means to make a change in county human services. Counties are required by state law to provide public health services and to provide social services. And this is a basic requirement that has been in place for a long time, and it doesn't change if you exercise any of the options under the 2012 law. But you could change the way you organize or govern those services. The key questions for the Board of Commissioners are, do you need that change? What are your options? What are some of the lessons learned so far from other counties? And those are the questions that I can provide some information about. Another key question, of course, is what are your goals? And that's really a question for you. So in thinking about the county's goals and what route will get you there, I thought I would show you, here are some of the goals that have been expressed by other counties. Do we have a question?
Quick question,
Sure.
and please forgive me for asking this, but, well, not for asking it, but now I understand. When you talk about population of the county, were you talking about in terms of the population or the makeup of the board?
I was talking about the total population of the county is what used to limit these options to Wake and Mecklenburg, but that's been taken away, so it doesn't matter anymore.
Okay, so another question. If the Board of Commissioners decide to take over running the board of the health department, there are certain individuals that compose the health department board, your veterinarians and things of that nature.
That's right.
How would that affect us as a board in running that?
Okay, if you were to decide to exercise that option, which I'm going to describe in just a moment, and I'll get into more detail then, but if you were to exercise that option, you'd no longer have an appointed board that reflected that membership. The Board of County Commissioners would be the board with the membership that you have that was elected in the county. So some of the goals that have been expressed by other counties who have looked at their options are listed here on this slide. Improving service delivery for citizens, creating a new vision for human services programs, creating a unified personnel system for all county personnel, something that I'll go ahead and emphasize now because I'll come back to it at another couple of points in the slides, is that the employees of local departments of health and local social services departments are under the State Human Resources Act. They're not under county personnel policy, so that is one issue that that some counties have looked at their options to see if they can make a change in that. Changing the relationship between the Board of County Commissioners and the departments, identifying efficiencies and reducing human services spending, and then there are some other goals that have been expressed as well. A consulting firm that is separate from the School of Government, but that also works with these issues in North Carolina, recently did a survey of 30 counties that have made changes under the 2012 law and determined that the top 3 reasons that counties have given for making the changes they've made have been to better coordinate their human services, to provide more direct oversight by county commissioners, and to have better integration of the agency into county government. Those were the top 3 that came out of that. This is a big picture look at all of the options that a county has under all of the current laws in North Carolina. Before we narrow the discussion to the options in the 2012 consolidation law, I just wanted to acknowledge that there is always the option of staying the same and not making any changes under any of the laws that are available. There are also options for different organizational governance structures under other laws that predated the 2012 consolidation law that we're focusing on today. And then there are the options under the consolidation law, which is the main focus of this discussion today. Since one of the options is staying the same, I did want to start with a quick look at what you have now, what that looks like. And if you look at the chart going from the bottom up, the county health department and the county department of social services are separate departments, and each of those has its own board. The county commissioners appoint the members of the Board of Health, and the Board of Social Services, the county commissioners appoint 2 of those members, but then the 2 members are appointed by the Social Services Commission, which is a state agency, and then those 4 members appoint the 5th. Each of these boards has legal powers and duties that they exercise mostly independently. And then the departments have directors that also have legal powers and duties, which include administering the department, but that go beyond that. I mostly study the public health side, and I can tell you that the local health director is mentioned in a wide variety of statutes and regulations with particular duties, and I understand social services is similar. So we used to call this slide the options under the old laws. Now I've changed it to options under the other laws because there's a new law that is going to provide a new option for social services departments beginning about a year from now in March 2019 to have a multi-county regional social services department. That didn't used to be an option. But just, I'm not going to spend a lot of time on this because I don't think this is where your interest lies, but I just wanted to let you know that there are options under other laws that include things such as multi-county agencies, or doing things with interlocal agreements in the absence of a multi-county agency working with another county, or a major one is intra-county collaboration and consolidation without making any changes of your governance structure. That's always an option for counties. But let's focus in and take a closer look at the options under the consolidation law, because I think that's what the primary interest is in here today. There are 3 things that I would like to ask you to watch for, 3 key questions or decision points for the county commissioners as we look at the 3 different options that were created by the 2012 consolidation law. The first issue, question, decision point for the county commissioners is, how will local human services be governed going forward? Boards of health and boards of social services have their own laws that give them particular powers and duties. The consolidation law allows the Board of County Commissioners to keep those as separate appointed boards, or the commissioners can assume the powers and duties of those boards and exercise them themselves. So that is That is one key question to keep in mind. And also I'll note here, and you'll hear me refer to it again later, there's a lot of repetition built into this because it's so complicated. So I hope you'll bear with me. If I'm repeating myself, I'm doing it on purpose because I live and breathe this stuff, but I know it's a lot of information to be dumping at once. So if the Board of County Commissioners does assume the powers and duties of these boards, then you're likely to have some advisory committees. You're actually required to have an advisory committee on health if you assume the powers and duties of the Board of Health. And then other advisory committees, such as for social services, if you assume those powers and duties, or for other things, are not required but are common. So that's question number one. How is governance going to be managed? Question number two, decision point number two, is how will the local human services be organized? And what I mean by that is really what's the agency or the department going to be? Are you going to have separate departments, or are you going to have that kind of umbrella department that I talked about, where you've got multiple departments consolidated into a single new thing that we call a consolidated human services agency? And then the third question applies only, it's important to know whether you're having separate agencies or creating a new consolidated agency, in large part so that you know whether you need to think about the third question, because the third question actually only applies if you create a new umbrella agency. If you create a consolidated human services agency, then you have options about what your personnel policies are going to be. And so that would be the third decision point for the commissioners, which personnel policies are going to apply. Yes, sir.
On your advisory committees, what is their duties and function?
And
how often do they meet?
Their duties and functions are not prescribed in the state statute. However, a lot of duties and functions end up coming out of North Carolina's local health department accreditation process, which requires local boards of health to satisfy certain duties and to undertake certain activities in order for the local health department to be accredited. And local health departments are required to be accredited. If the Board of County Commissioners assumes the powers and duties of a Board of Health, then by operation of law, all of those accreditation activities go to the Board of County Commissioners. But some of them may be delegated back to the advisory committee. And we'll take a closer look at that later in the slides. I have a breakdown of exactly what can be delegated to the advisory committee and what stays with the Board of County Commissioners. It's a great question. That's why I have a slide on it. But on the personnel issue, just the main point I want to make about that is that the choice of personnel policies only comes into play if you actually create a consolidated human services agency. And so we want to be clear about what that is. This is a summary of the three options that the new law creates, and we'll take a closer look at each of these. One of the main points of this slide, honestly, is to introduce you to this color coding system that we have for identifying counties on a map of North Carolina that we try to keep up to date at the School of Government, that lets us know which county has chosen what action under the consolidated law of 2012. So here's the introduction to that, and again, there's going to be some repetition here. Option one is we identify that in pink. It should look like that in your printout. The colors sometimes change a little when they're projected. Maybe it looks purple here, but option one is in pink, and that changes only the governance of the agencies. The Board of Commissioners assumes the powers and duties of boards, but does not create a new agency. And the real big significance of that is that there's no option on personnel policies. Option number two should appear as blue on your paperwork, on your slides that you have there. And it creates a new agency. Option three in yellow also creates a new consolidated human services agency that has personnel implications. The two main differences between 2 and 3, the one main difference is that 2 has this consolidated human services board that's appointed by the county commissioners, and 3 does not. So that's sort of the quick overview, and then let's take a closer look at each of those to be clear on what the difference is between them. So under option one, this is your pink counties if you're looking at your map. A Board of County Commissioners abolishes one or more of its human services boards and assumes that board's powers and duties. And I want to point out, I just said you abolish one or more of the human services boards, because you don't have to do both. You can do one, you can do the other, you can do none. But that's what option one is. That's really all there is to option one. There is no action on the agencies themselves in this model. The action is limited to the boards. The individual agencies remain separate. You do not have a consolidated human services agency. And there are several different things about that are significant. Perhaps the most important to people is that means there's no change in personnel policies. Employees remain subject to the State Human Resources Act. In a model like this, if the Board of County Commissioners has assumed the powers and duties of one of these boards, say it is the health board, then they get the authority to appoint the director of that particular department. Likewise, if it's the social services board, then the Board of Commissioners get the authority to appoint the director. On the public health side only, if the commissioners would be required to appoint a health advisory committee if this option were exercised. On the social services side, it's not required, but it's allowed, and a lot of places have chosen to do that. And the advisory committee has to match the membership of a county department, a county board of health. This is one thing that people mean sometimes when they say that they have consolidated. I think that the use of the word consolidated gets quite confusing, and particularly in this scenario, because in this scenario, the departments are not consolidated. There's no consolidated agency. There's no consolidated board. So I find that a little bit confusing. But it is a kind of consolidation of governance because everything is brought under the county commissioners. But this is one of, when you ask a county if they've consolidated and they say yes, they can mean a number of things. And this is one of the things that they might mean. We call that option one. By the way, option 1, 2, and 3 does not appear in the state statute. Those are terms that we came up with to sort of help ourselves organize our thoughts around, we at the School of Government, around how to explain these different agencies. I think if we knew that people were going to pick up on our terminology, we would have come up with cooler sounding terms than option 1, option 2, option 3. But these terms do seem to have been picked up, and sometimes we even see them reflected in people's resolutions where they say, we've chosen option 2. It's like, okay, we'll keep good records of what we meant by that so that people will know going forward. All right, so option 2, which is blue on the maps that you have, this is the first of the 2 options in which you actually create a new agency, a consolidated human services agency. In option 2, you also create a new board, a consolidated human services board. So how does this work? You combine 2 or more county human services departments to create the agency. You're allowed to include public health. You're allowed to include social services. You don't have to include both, although most people do. You can also include other things that you consider to be human services. We don't actually have a legal definition of human services, but what we've seen in other counties is that people tend to look at things like aging, veterans affairs, youth services. Those are the types of things that people tend to include. Transportation, human services, transportation in these agencies. In this model, there is an appointed consolidated human services board. It can have up to 25 members, and it is appointed by the Board of Commissioners, but it must be appointed from a slate of nominees that is presented by a nominating committee. I'm not going to go into the details of the procedural steps that are required for that nominating committee, but I do want to just sort of flag for you that it is something that it would be important to be attentive to, those procedural steps and the requirement for the nominating committee if you were to choose to go this route. The new agency is led by someone called a Consolidated Human Services Director, and that is a new title and it's a new role for someone, but it does not have to be a new position or a new person. On the other hand, it can be. This is one of those things that we've seen different counties handle differently depending upon their own needs and their own resources. Some have appointed the existing Health or Social Services Director to the Consolidated Director role. Some have appointed an Assistant County Manager. Some have brought in someone entirely new and different. In this model, the board does not hire the director of the agency. It is the county manager who hires the director of the agency, but the county manager must have the advice and consent of the board, so the board still plays a role. The Consolidated Human Services Director either must have the qualifications to be a local health director, him or herself, or must appoint another person who does. That's just another requirement. It exists only on the public health side for reasons that I think have to do with legislative drafting more than anything else, but it is a statutory requirement that there be someone designated who has health director qualifications in the county. And the expectation is that that person will have the powers and duties of a local health director delegated to them. This is the first model where you've got this new agency that you've created. I refer to it as an umbrella agency. The official name of it would be a Consolidated Human Services Agency. This is the first one where you get to decide what personnel policies you want to apply to these employees going forward. There is an option of keeping them under the State Human Resources Act, which is basically where you are right now, or pulling them out and putting them under county personnel policies. The default is actually to go to county policies. So if the desire is to stay under the State Human Resources Act, the resolution needs to say that explicitly when you create the new agency, to be very clear that it's not going under county policies. If it is going under county policies, it's also important to involve the HR director early on to make sure that the county policies are updated to the federal merit personnel qualifications that are required for many of our social services and public health programs. All right, so option 3. This is in yellow on your maps. It's sort of a combination of the previous options. It creates a new consolidated agency, as we did in option 2, but then it removes the appointed board, which is the same thing you do in option 1. So that's why I say it's sort of a combination of the two. The powers and duties of the Consolidated Human Services Board transfer to the Board of County Commissioners, and then the Board of County Commissioners acts as a Consolidated Human Services Board. That includes the powers and duties of a Board of Health, if public health is included in the consolidated agency. It includes the powers and duties of a Board of Social Services, if social services is included in the consolidated agency. And all of that happens by operation of law. There's not any decision-making about, we'll take these powers and duties, but not those or anything like that at all. By operation of law, it all transfers to the county commissioners. In this model, again, we have the county manager, who is the person who is responsible for hiring the director of the agency. The requirement to get the advice and consent of the consolidated board is still in there, but in this case, it would mean that the advice and consent of the county commissioners is required, because the county commissioners are the ones who would be acting as the consolidated board. If public health is included in a consolidated agency that's created under this model, then there must be an advisory committee on health with the same membership as a county board of health has. And again, you've got the option here of county personnel policies or the State Human Resources Act, but the default would be to go to county policies unless you stated specifically that you wanted to stay under State Human Resources Act. So this is what the state looked like in 2012. If there's no color in a county, that means that its agencies were not consolidated. We had 2 consolidated models, and it was just Wake and Mecklenburg for the historic reasons I described earlier about their populations. In Wake County, they had a Consolidated Human Services Agency with an appointed board, and in Mecklenburg County, they had originally just assumed the powers and duties of boards. Later on, had created a consolidated umbrella agency as well and assumed the powers and duties of its board, and so they were a yellow county. And that's where we were when the legislation passed in June 2012 that took out that population threshold that kept other counties from acting. And then this is where we were, to the best of my knowledge, as of February 1st of this year. And I do want to emphasize that this is accurate to the best of my knowledge, and the reason I have to give a little bit of a caveat there is because we do rely on counties to let us know when they make a change in their human services organization and governance. They're not required to tell anybody. When They interact with state agencies over social services or public health. Those state agencies obviously are going to know, but there's no requirement to check with anyone or get permission or even to let anyone know. So this is based on reports that we've received, and the colors that we've chosen to represent the different counties are what we think they have done based on their resolutions. A bit of advice that I have later in the slides is to be really, really clear in your resolution, because I have read a couple of resolutions that I've not been entirely sure which option was adopted by the county, and I've had to call up and ask for more information because it's not clear from the resolution, and it would be good to be clear. So here's where we are now. We have as best I know, 3 counties that have elected to go with option 1 for both their health and social services agencies, and that is the solid pink counties. So option 1 I mentioned earlier is in pink, but now I've got some that are solid and some that are striped. What is up with that is that the striped counties represent counties that have acted on only one of their boards and not both, because remember I said that was a possibility. So far in North Carolina, every option 1 county that has acted only on one board has acted only on the Board of Social Services. If we get a county that acts only on public health, I guess we'll have to come up with another pattern, or maybe turn the stripe sideways or something to, and our legend is going to fall off the page at some point with all the different ways that people are interpreting what they can do under this law.
Question.
We have
You got a question?
12 counties. I'm sorry?
Do you think the reason that they have leaned towards the Department of Social Services being, do you believe that the reason they lean toward the Department of Social Services being the one consolidated in the Board of Commissioners is because of the requirement that public health have a public health director, so you need it anyway? Why is it leaned so far? Why did all the counties just sort of lean to the social services as opposed to the health department?
I think that there are different reasons that the different counties have chosen to act on that, but one really pragmatic reason for at least some of these counties, especially a couple of these up here and here, is that we have multi-county health departments in some of those areas, and so the commissioners could not assume the powers and duties of the Board of Health without withdrawing from the multi-county regional health department first. And so that would have been, that can be done, but it's a multi-step process. But I think in some of these areas, that is probably the explanation. We have others where that's not the case. This is Columbus County. It doesn't have a multi-county health department, so I'm not sure what their motivations were, but they did go with just social services. So the blue counties up there are consolidated human services agencies that include both. The solid blue, they include both public health and social services, and that's mostly what folks have done when they've created consolidated agencies in North Carolina, is they have put both of them in there, but when they have not, again, they've included only social services. This blue patterned county is a county that has its social services agency and a couple of other things in its consolidated agency, but it does not have public health in its consolidated agency. They're blue, that means they've got an appointed kind of consolidated human services board. The county commissioners are not acting in that role. And then the yellow counties are the consolidated agencies that are governed directly by the county commissioners, and all but one of them also include both public health and social services. The one that doesn't is here in Cabarrus, and it includes social services and some other things. Both of those dotted counties can be explained by the fact that their health departments were a different kind of model that would have had to be unwound, I think. So, a lot of colors and a lot of information. These are the key differences. A summary of the key differences between the options using the color coding and focusing on the differences that counties examining their options tend to ask about the most often in my experience. First, what does the option mean for your agency or agencies? If you're in one of the counties that doesn't have a color assigned to it yet, then that means you've got separate agencies. Pink, you still have separate agencies. 2 and 3, you've got a consolidated agency. which is any combination of human services, potentially including public health and social services, but not necessarily including both. Second, who's the board? Is it appointed or is it elected? And by elected, that means it's the Board of County Commissioners. That's who's serving in that role. Third column, who gets to hire the agency director? Is it the board, the appointed board? Is it the Board of County Commissioners? Or is it the manager with the advice and consent of someone? Those are the basic options there. And then final column, what are your personnel policies? More to the point, does it have to be the State Human Resources Act or can it be county personnel policies? So those are the main things. I've mentioned this, but just wanted to give a quick example of how the law does not require any particular mix of human services. What the law specifically says is that it may include public health, social services, and other county human services departments or programs, but it doesn't have to include any particular mix. And our counties have interpreted that a lot of different ways. I just pulled out 3 that I thought illustrated well the range of options. These are, of course, not the only 3 ways you can do it. It could be done 100 different ways as far as I can tell. But Gaston County is an example of a consolidated county that includes both public health and social services, has an appointed board, and also includes these other services that you can see, transportation, aging, etc. Guilford County also includes both public health and social services and a couple of the same things that you'll see in Gaston County. Main difference there, it's in yellow, it's Board of County Commissioners, serves as its board. It doesn't have an appointed board. And then in Cabarrus, we've got one of our social services only agencies, but they have called it a consolidated human services agency by adding in aging and transportation, and that has permitted them to make some changes in their personnel policies. The way the organizational charts look for these different agencies varies tremendously as well, and I'm not sure that any 2 look alike. This is a grossly oversimplified illustration of some of the approaches to organization that we've seen emerge, from the very simple, where you've got the manager who is over the consolidated human services director. The example given here shows that person as also being the social services director. In some counties, it's the other way around. It's the public health director, and then another director under them. All of these include both public health and social services, but as I mentioned, we have a couple of models that don't include public health, and I think the main point here is that there's no requirement that there be any particular kind of structure. However, there are requirements that there be particular types of directors and that they be appointed in particular ways. So if the Board of County Commissioners were to choose to create a new consolidated agency, which is either option 2 or option 3, yellow or blue, then the agency would be required to have a governing board. In option 2, the governing board is appointed by the Board of County Commissioners, and it has the membership that you see represented on the left-hand side of this slide. Includes a county commissioner, some consumers of human services, certain categories of professionals, and then up to 12 other people. It can be up to 25 member board. In option 3, the commissioners do not appoint those members. Instead, they take on the powers and duties of a consolidated human services board themselves. And it doesn't matter if the commissioners don't represent these things. They're not required to when they assume the powers and duties of a consolidated board. They are required to appoint a health advisory committee and may appoint other advisory committees, but they don't have to represent that membership. The main thing when the commissioners assume the powers and duties to themselves is that they get all of the powers and duties of a consolidated human services board. And that includes some specific things that you see listed here that are actually not really well spelled out in the law and are somewhat duplicative of the powers and duties of a Board of Health and Board of Social Services, so I won't spend a lot of time on them. But they get those, but I think the main thing is that they acquire the powers and duties of a public health board if it's part of the agency, a social services board if it's part of the agency, both if they're both part of the agency. And so I thought it would be worth taking a moment to take a look at what the powers and duties of those boards are as well. So a consolidated agency that includes social services That means the board also acquires the powers and duties of the social services board. In an option 3 county, that would be the county commissioners exercising those powers and duties. In an option 1 county, if you assume the powers and duties of the board of social services, this is what you get. Include consulting with the director and preparing the social service agency's budget, the authority to inspect social services and public assistance records with some limitations on that, the authority to make some decisions related to workforce special assistance and services funded through the social services block grant, and in some cases reviewing suspected cases of fraud for some public assistance program. Now, I'm not the social services expert. I wish my colleague Amy Wall could have been with me today. We travel as a team whenever we can, so that we've got both social services and public health in the room. But she's meeting with the social services work group today, and so could not be here. But my understanding from her is that many of these may be delegated to the director or someone else within the agency, many of these powers and duties. And that's a bit different from Board of Health, which is something that I also know a little bit better. If you were to create a consolidated agency that included public health and then assume the powers and duties of the consolidated board, or if you were to leave the agencies as they are, but just assume the powers and duties of your Board of Health, then the Board of County Commissioners gets these powers and duties. And they include making policy for the agency itself, how it's going to operate. Adopting local public health rules. That's a rulemaking authority that is, it's a local lawmaking authority. It's in some ways similar to your ordinance making authority, but it has some significant differences from county ordinances. For one thing, it gives you jurisdiction over municipalities within the county if you adopt a public health rule, but your rule can only be about something affecting public health. There are limitations on the subject matters of public health rules. So that is something that the county commissioners acquire when they assume powers and duties of a Board of Health. Adjudicating disputes regarding local public health rules or locally imposed public health fines is another duty of a Board of Health. I don't know if that's one, maybe I know we have some Board of Health members here. Have you ever had an adjudication? It's not something that comes up very often, but when it does, it is I'm getting a no, shake of the head. When it does come up, it is something that requires the board to basically, the board's required to accept certain requests for adjudication, and you have to act basically as a court and make a decision about someone's grievance, about a particular action of the health department or the staff. Setting local public health fees, and then the one that I alluded to earlier and that has a lot of substance to it is satisfying the state accreditation requirements for local boards of health. So let's take a look at that, but first just to summarize here what happens when the commissioners decide to assume the legal powers and duties of boards that are abolished and no longer have appointed boards. That means that the commissioners assume the legal powers and duties of those boards and may also appoint some advisory committees. The advisory committee on health would be required. Additional advisory committees are allowed, or something else that we've seen a lot of counties that have public health and social services in the same agency do is they've appointed an advisory committee on health and human services that includes all the members of a county board of health, but then adds in some people to represent the social services perspective as well. And the law does permit that to be done. But let's get back to the health board. If the commissioners assume the health board powers and duties, then who has to do what? The question here is which powers and duties must the Board of Commissioners exercise itself if it does this, and which could be delegated to the advisory committee instead. And this goes back to the question that came up early on about what would the role of the advisory committee be. There are some things that are not delegable to the advisory committee. The law has developed since 2012 and become a lot more clear on that than it used to be. And the things that are not delegable include the statutory powers of a Board of Health, the adoption, which includes the adoption of public health rules, the adjudication of disputes if you have those, the imposition of local fees. And in addition, there are some accreditation activities that are delegable, but there are some that are not. Why this is important is because health departments in North Carolina are required to be accredited by the local health department accreditation board. It's not optional. And that requirement applies to any type of health department, including a consolidated human services agency that is, has incorporated public health. You have an accredited health department here in Cumberland County. It was accredited initially in 2013 and re-accredited in 2017. So your next accreditation will be due in 2021. And work on that will likely start a year or more ahead of time. The accreditation process does impose a number of duties on local boards in the form of something called accreditation activities that the board is required to satisfy. And either an option 1 or an option 3 county, those duties are going to fall on the county commissioners. Unless the accreditation activity specifically says that the advisory committee can do it instead. And I'm not going to spend your time reading the slide to you, but you can see the types of things that are in the accreditation activities that the accreditation board has determined may be delegated. Things like reviewing data and communicating with other entities and advocating for public health in the community are things that may be delegated, but some of the activities such as participating in the establishment of public health goals and objectives, participating in public health board training, those things may not be delegated to the advisory committee. Okay, so lessons that we have learned, some lessons learned from watching this law develop and be implemented over 5 years. This is just sort of a hodgepodge of things. We keep hoping that someone will give us a lot of money to study this so we can see, can find out some good solid hard data on things that have actually changed. I'm reporting anecdotes here, so I want to be upfront about that. This is not data-driven findings, but just some things that we've observed from counties. There's some in the area of organizational structure. There's sometimes not as much flexibility in that as people expect beforehand. You can reorganize programs within a consolidated agency, but the specific activities or functions that an agency carries out are often determined externally by federal or state law, and those are sometimes pretty prescriptive about what a program must do or may not do. There also may be outside law affecting who can be responsible for some activities. For example, one that I get asked about a lot in the public health side is environmental health programs. Sometimes people want to know if they can use the consolidation law to move that outside of the health department and somewhere else, and the answer to that is no, that there's actually another state law that says that you can't take a program that's a duty that's prescribed, that is assigned by statute to a particular department and given to another department. That doesn't mean you can't co-locate your programs in a way that makes sense for the county, but it just means that the lines of report, the lines of authority, have to follow the statutory laws. We've learned a lot of lessons about employees. One of the main things that we have heard from Consolidated Human Services directors is that it's very important to communicate with employees about any changes that are going to be made and communicate up front. And with advanced discussions, if at all possible, about what the changes are going to be and how that's going to affect them, especially if there's going to be a shift from the State Human Resources Act to county personnel policies. There are likely to be a lot of questions in that area, and in some of them we have answers, and some of them we do not have answers. For example, there is an open legal question about whether employees who have obtained career status under the State Human Resources Act gets to carry those protections forward, or if they don't. The conservative advice that we have from the School of Government is to grandfather in employees with who have obtained career status, because we're not going to know whether you have to continue their protections or not until somebody sues. So if you don't want to be the subject of a lawsuit, our advice would be to grandfather the employees and carry that status forward. But we really don't know if the court would say that that's what you had to do or not. Updating HR policies or your HR ordinance well in advance if there's going to be a change from the State Human Resources Act. That's a really important thing to do. I referred to this earlier, there is something called the Federal Merit Personnel standards that, that's, you know how when you get federal money, it has strings attached to it? That is a string that is attached to a lot of the money for social services and public health programs, is that employees be subject to these federal merit standards, which basically just mean that people are hired on the basis of merit and are discharged for cause. That's the quick summary of them. There's more to it than that in the weeds, as you might imagine, but that's basically what it comes down to. Advisory committees, we've talked a little bit about what they can do, but it's also, I think, important to think about what do you want them to do. We do have, early on, before the accreditation standards sort of came up and said, okay, here's some things you could delegate to the advisory committee. We had a lot of questions from advisory committees who were saying, well, we exist, but we're not doing anything. So defining that role, defining the expectations, making clear that everyone knows what they're there for and what they're not able to do, and making appropriate delegations and making clear that that delegation has been made would all be things that I would put under lessons learned. Information sharing. I haven't heard this from your county yet, but it comes up in a lot of counties that sometimes a goal is for information to flow more freely from one program to another, with the recognition that sometimes there's an overlap in clients of the two different agencies. Unfortunately, confidentiality law is a bear. It's an area that I work in. My colleague Amy Wall works in it, and it's incredibly siloed, if I may use that jargon. You know, the confidentiality requirements tend to come from above, either the federal law, usually it's federal rather than state, so we can't really do anything about it. And they're tied to programs, and so the information flow is actually a lot more complicated in a consolidated environment than it is in a separate department environment, because some information exchange that seems like it would be natural and would make sense, it would be efficient, is not permitted. And so there's a lot of knots to untangle in that area. And then budget impact. Don't assume creating a consolidated human services agency will save money. It might not. We've heard anecdotes on both sides. I did note that I mentioned earlier that the consulting group had done a survey of our 30 counties that have made changes, and budget impacts turned out to be pretty low on the list of priorities. I was a little surprised by that, because 5 years ago that was what we heard about the most, but I think people have come to understand that it's not necessarily a money saver, and that's no longer a key motivation for people doing it. If you do decide to take action, there are some procedural steps that must be followed. Public hearing is required. It must have 30 days notice. And then the second bullet point is really, that's my advice, and in some ways that is my plea, that there be a resolution that clearly reflects the chosen action of what's going on. And I've just outlined here what to say in the resolution, but the main thing is to be very clear about what option you've chosen and what that means. And so, you know, if you're creating a new consolidated agency, which agencies, which departments are being put together, which are not. If you're going to have a new consolidated agency, you're going to appoint the board, or the county commissioner is going to assume the powers and duties of the board. That's got to be, if the commissioners are assuming powers and duties, that must be stated in the resolution. The statute says that. But a lot of the stuff here is just sort of my advice, so that there's a good record going forward of what you have done. Last month I was in Mecklenburg County, and their initial actions under this law were taken so long ago that they'd actually, in some cases, sort of forgotten what had happened. And so having a good paper trail of what you've done is really important, and that's what this is all about. I've taken more time actually than I intended, but I am at the end of my presentation and would be happy to take your questions. I also want to let you know that you have a few extra slides that I did not intend to discuss, but that I wanted to make available to you because I understood there might be some questions about what's going on with the Social Services Working Group. And my colleague Amy Wall is having a meeting with that group today in Chapel Hill, and that's where they are. I asked Amy what's the one nugget of most important information about the Social Services Working Group that people need to know, and she said it doesn't mandate regionalization. They're looking at a lot of different issues, including regional supervision as a starting point, and they will be also looking at different ways to organize social services agencies, and there will be an option in March 2019 for counties to create regional social services agencies, but it'll be an option similar to what already exists for public health. It wasn't mandated by the law that was ultimately passed. There was an early version of the law that was going to mandate it, and I think that's why that question comes up. So I'd like to ask the commissioners if they have questions.
Thank you for that presentation. A lot of these, this is just personal, not on behalf of the board or anything, but sometimes I get to the end of a presentation, I go, I can't get that half hour of my life back. I would sit through this again several times. This was very informative. It's a very complicated issue, and thank you for giving us such a concise, info-loaded packet. Two things. One, I wear all kinds of glasses. I have the little miniature ones here, and I take my notes in the margin. Can I get from you the big ones to 8, half by 11?
Commissioner Bush, we have it.
You have that?
Yes,
Okay.
sir. We'll send it out.
All right, excellent. And I know I don't want to put you on the spot, but I don't want to let you get away without at least asking you. Knowing with your expertise and our demographics and as the things have changes, do you have any gut feeling on where we might want to at least start looking at a 3 rather than 3 choices?
I have honed my skills in refusing to answer policy questions for 20 years. My gut feeling is you're doing the right thing by studying this and taking it seriously, and that's my best advice.
Perfect answer. Thank you very much.
Thank you. I would like to also echo what Commissioner Bruce said. This is very insightful. We had all sort of looked at it from a very high level, and I think all of us may have had our minds opened up a little bit about not only the excitement about what we could be, but also the perils of what we may get with every decision we make. I realize that we talked about human services, and back in 2012 when all this happened, we were still kind of going through the process with mental health, the MCOs. And although it's a little bit out of our locker room now as county commissioners, do any of these agencies still, maybe on the outside, look after the mental health with the MCOs also? Because one of the things that I'm seeing, the pattern that's moving forward with this, is the consolidation allows many of the same citizens use some of the same services. And the consolidation may possibly help in efficiencies of service. But I am curious if there's is there still a tether at all with mental health?
Yes and no. On the one hand, one of the rewrites to the law in 2012 said what you cannot include in a consolidated agency, and it said you can't include mental health. So that is no longer allowed to be. You can no longer include the part of mental health that is the responsibility of the LMEs and the MCOs. But we do have a number of health departments in North Carolina that are starting to have contracts or services related to mental health. And that can be included if it's part of the health department that's brought into a consolidated agency. But that is something that is just varying from place to place depending on interest and resources.
Anyone else? Well, thank you, Jill.
Thank you, Mr. Chairman.
Thank you. I guess it's time to have a snack or two, or mingle around a little bit, let's chat. But we'd like to thank everyone for coming this afternoon. And do you have anything to say, Dwayne?
Nothing other than the commissioners. Definitely, again, want to thank both our social services board as well as our public health board. And one of the things that Jill told us at one of our earlier meetings was she really congratulated Cumberland County for our due diligence up front. I think one of the things that they've experienced is that a lot of counties made decisions based on incidents or situations and then may have sometimes called them in after the fact. And they appreciated the fact that we called them in up front as a part of our due diligence process. So just want to congratulate really all of us, especially the Board of Commissioners, for a very deliberate process.
Thank you. Our meeting will be adjourned at this time. Do we need a motion or anything? Motion, second, all in favor? We are adjourned. Thank you.